So we're here for your 3-month post stem cell lift evaluation. Yep. The stem cells have taken very well. You have your volume, and it's about 80% take because the stem cells are alive, and we need to wait 3 months, which we've waited for them to take. And what I would like to do today is see if there's anything that we need to touch up and make sure that everything is perfect, so that the fat that we've saved from the first treatment, we can use it and get you a complete result. So there's a little area here where we're going to fill, and over here we're going to do a little bit more. And over here, this is a little bit more asymmetric. We need to fill a little bit here to give you the balance. This time is going to be a lot easier. We don't have to take fat out. We're going to use the fat that we already have stored. And we're just going to do those touch-up areas. So your downtime is going to be minimal, and your recovery is going to be very easy. Here. The areas where we marked are where she has a little indentation here that we need to correct. She has a little bit of asymmetry from this side to this side, and we're going to lift this up a little bit so she gets improvement there. A little bit of the areas here where it's indented we're going to fix, and maybe we'll put a little bit in the temples to balance everything.
The betadine is to prep the face to make sure there's no bacteria or anything, to basically sterilize it.
So we're going to inject here. Okay.
So Dr. Newman just finished giving me the injections, local anesthesia. I don't have any other kind of sedative or anything. So just a little poke here, a little poke there, and I'm all done. So now comes, Dr. Newman said, the fun part.
So now, with a little needle, we're going to make a little opening in the skin for the cannula to go in. Now we're going to use the blunt instruments, so you don't have to worry about it going into anything like a vessel or having any complications from the injection of a needle, because this is a blunt cannula.
See, I don't feel anything there except
pressure.
I feel your fingers on my face, but that's all I feel.
So we're going to do the same thing on this side, but we're going to try to adjust for the asymmetries. Now that we're injecting, we're basically trying to fill in the defects, and what happens with the cells, they'll go in gradually and they will incorporate into the tissues, and as they incorporate into the tissues, they start to do the repair of the tissues and improve the skin tone and texture.
Well, I'm told that we're done, and that it was only about 25 minutes, and Dr. Newman didn't even mess up my hair.
We're going to clean you up, let you see it. You have a little bit of swelling. This is normal. The swelling is going to last for a few days and gradually go down. And as time goes on, it will settle in and it'll look more and more natural. So, you want to see what it looks like?
Yes. Wow. Oh my gosh, this is better than last time.
I tell all my friends, if they're thinking about having any kind of rejuvenation process, don't make a decision until you check out the stem cell lift, because honestly, I don't think there's a better alternative. I think it's the best procedure out there for rejuvenation, without the surgery, without the scars. There's no let me see your scars, nothing. You just look better. 2 days later, you're out having lunch and shopping and doing everything you do. It's the only way to go.
The stem cell lift for facial rejuvenation is a novel and revolutionary concept in doing facelifts. We're taking the fat and the stem cells found in that fat, concentrating the stem cells so that we have the power of those stem cells to rejuvenate the skin and raise the skin up in 3 dimensions to give the volume back so that you look more youthful, and by doing this, you look young, not done. Stem cells are the genetically programmed cells in your body that are meant to repair, regenerate, and maintain healthy tissue. So if you have damage or a cut or a wound, what your body will do is wake up these stem cells that are dormant to help repair these areas. Every part of your body has stem cells. There's about 10 to 100 times more stem cells in your fat than there is in the blood. The way we get the stem cells is doing a procedure like a mini liposuction, where we try to preserve the cells alive as we extract them from the body. Once we have the fat, we then separate the stem cells that are found within that fat to be concentrated and activated. And once those cells are separated, we can either use them by themselves or we can add them back into tissues with your own fat to lift and volumize. By doing traditional surgery and pulling, we cannot restore that volume. We just tighten everything and you look done. By doing that, you have a risk for scarring and you have a risk for damaging the nerves. In traditional surgery, multiple procedures would need to be done to achieve the same thing that we can achieve with one procedure using the stem cell lift. When we use the stem cells, we don't have to worry about allergies, we don't have to worry about rejection, because this is from your own body to your own body, and it is the most natural way of helping you maintain your youth or your health. The average cost of the stem cell lift for the face is between $5,000 to $10,000, depending on the complexity of the procedure. Not only can you use the stem cell lift to rejuvenate the face and the hands, it can also be used for joint repair and for reconstructive purposes to correct indentations and defects from trauma or previous surgery. The stem cell lift can also be used for skin diseases, such as the autoimmune disease in the genitalia called lichen sclerosus. Unlike traditional plastic surgery, the stem cell lift requires no anesthesia, no knives, no scars, has minimal downtime, and is much more affordable.
I chose Dr. Newman because I've been going to both his father and brother, who are both physicians, and it's a name I can trust.
All I can say is that I feel amazing. I just love it. I love my look.
Whenever I see Dr. Newman and he does a procedure, it just refreshes the way I look and the way I feel.
If I had to do it again, I would do it again.
It's been 6 weeks since I had my stem cell lift procedure, and I feel great, and I think I look great.
I was taking an oral medication for cystic acne, and I had a very bad reaction, and the skin on my face started to break down across the bridge of my nose, underneath my lower lip, down into my chin. It was pretty dramatic. My first attempt at treatment was a round of antibiotics, and that went to another round of antibiotics. They didn't work. The wound was increasing in size. I was freaking out. My face was getting worse and worse. I knew I was in trouble. I stopped taking everything, and I knew I had to seek other treatment. I was advised to have surgery right away, which I did, to try to close the wound, and that ended up being a disaster. When the wound wouldn't close, it changed my life completely. I was always very active. I had lots of friends and belonged to lots of different groups. I had a trainer and I lifted weights 3 times a week, and I did a lot of things with my family, and it changed completely. I couldn't do any of those things anymore. I was very worried about infection, and so I was pretty much confined to home. And you would not believe the things that people will say to you on the street. So that was also just a change in who I was. When I lost my lip, everything changed. You think that drinking a cup of coffee, you just pick up the cup and drink it. Not when you don't have a lip. You can either cave or you can be empowered. And for me, it was showing other people, you are much stronger than you think. After years and years of endless surgeries and traveling all over and spending all of my money, I had just given up. This was my life, just live it. And then I got a phone call, and she mentioned Dr. Newman. And so, amazingly, I got to call him and talk to him for probably about 45 minutes. And he said, "Beth, come out. I think I can help you." So I came to Beverly Hills for my first treatment, and it was a little bit scary, but amazingly, I walked in the door and I was greeted by a wonderful staff, very warm, generous, kind. And then here came Dr. Newman, and he sat right down in the waiting room and visited with me, and it was easy. It was nothing like I had imagined.
The biggest challenge in a person like Beth is that there's no movement, there's no room to put anything in that area because everything is scarred down.
They're going to use my fat, and how will that be? And they're going to inject it, and it's in my jaw and my mouth. How's that going to be? And it was fine. It was fine. It was so much easier than everything I had been through. And I had real hope. I knew that I'd made the right decision.
We're doing the stem cell lift to restore the function and the normal appearance of the lower lip and the chin area.
I didn't have to go under with anesthesia, which was a real plus. And they did liposuction and took my fat cells goodbye.
The stem cell lift is unique in that it does not require any general anesthesia, there's no cutting, and there's no risk for rejection because we take the stem cells from your own body's fat. The stem cells sit in between the fat cells, and we're going to collect those stem cells and concentrate them so we can inject it into her face. Unlike regular surgery where we have to cut and open up patients, here if we go through a needle mark, the patient is very comfortable. We don't need to go under general anesthesia. There's much less risk for infection, much easier recovery for the patients as well. So we just finished harvesting the fat from the abdomen, and we're going to now separate the stem cells from the fat that we got. And while that's happening, we get some blood, and we get the platelet-rich plasma, which is the platelets within the blood. We concentrate them as well to help support the stem cells as we inject them into the face. What we're going to do is we're going to use the PRP, and hopefully with the fluid, we'll be able to spread out some of this tissue, so when I want to go in and inject the cells, it'll be easier to get them in. Also, with the PRP, we may be able to separate out some of the tissue here, so we get more movement. One of the things the PRP does is that it helps to stimulate the stem cells. The other thing, it's part of the wound healing process. So when we inject it, we actually start creating new blood vessels and improving the tissue blood flow. We have the fat with the stem cell enriched cells here. We're going to inject the stem cells plus the fat to give her some volume, trying to break up all the scar tissue. The stem cells will bring the blood supply and they'll re-establish a normal structure to the scar so that it's more pliable and it's not so dense. This is much better than the first time we did it. And that's it. I think she's going to do fantastic.
After my procedure, I went to recovery, and then went back to our room and slept for a couple hours. And then I felt so well that we just decided we would go out to dinner and celebrate. And we did, that same night.
Beth is going to have two parts to the recovery phase. The first part is the initial swelling and bruising, which takes about 2 weeks for both where we inject in the lips and chin, and also in the abdomen where we took out the fat to get the stem cells. And then after that is the incorporation of the stem cells into the tissues, which takes about 3 months.
When I got home after my stem cell lift, I was ecstatic with how quickly I could see results. I could speak better, the scar tissue was loosening, eating was so much easier. Dr. Newman had explained that this could be a long journey. It could take quite a few treatments, but I was so surprised at the results I saw right away.
Beth has done incredibly well with her treatments up to this point, and probably with 3 more treatments, she'll have tremendous improvement in the lower lip to the point that she can have almost full functionality of that area.
I know you probably have doubts the way I had doubts, and it's frightening to take another chance, but call Dr. Newman's office, make an appointment, find out about the stem cell lift, find out what it can do for you, because it can change your life the way it changed mine. Take a chance.
We're about to do the blood draw for the PRP. Using the platelets that are found in the blood, we concentrate them and we use them to produce these growth factors in the skin as we inject it into the areas that we want them to repair and rejuvenate. It helps to bring in new blood vessels, new collagen, new elastin, and really is a true anti-aging process. We're about to start doing the non-invasive thermite treatment, and what's amazing, we can do all the way up into the eyebrow and the eyelid, so we can get an eye lift without having to cut. We're going to do the lips to improve the lines here and to improve the skin around it. We're using the infrared camera to monitor the treatment area, and once we get to the end point of the treatment, we stop in that area and we move to the next area. The monitor shows us over here that the skin is heating up very nicely. It takes about 20 to 30 minutes to do one half of this face. We can then look and see the difference between one side and the other. The same thermite device can be used all over the body. It's not limited just to the face and neck. One of the great things about doing the thermite treatment, not only do you see the immediate change in the skin, but it continues to do a cellular change over the next 3 to 6 months, and you continue to get improvement.
Right now I'm feeling soothing heat to my face. It's actually nice.
I'm just going over each area at least 3 times and getting it up to the set temperature. You can already see some improvement in her lines.
So we just finished half the face, and as you can tell, the eye has lifted, the lines are less prominent. So we're going to start now on the second side. One of the great things about this technology is that it can be used on all skin colors, because we're not doing anything to the skin surface, it's all working underneath to tighten the collagen. Now we're about to start the Thermi RF portion.
So I'm just prepping with the skin with some betadine to sterilize the skin.
Do a little bit of numbing here. You're gonna feel a little pinch. It's okay? Where I'm treating now on the jowl area, you can see that it's heating up and is becoming white, and is telling me what I've treated and what I've not treated. So it's a great guide. It tells you exactly where you need to be. On average, anywhere between half hour to an hour, you can do most of this treatment. We've started doing the second side. In Marsha's case, the skin is pretty thin, so It tends to heat up very quickly, but she has a lot of these deep lines which are harder to treat. So in her case, we're going to add the platelet-rich plasma to improve the quality of the skin and to improve the healing process. We're done with the ThermiRF, and now we're going to put the platelet-rich plasma, the PRP. We're going to inject it into the area that we treated so that we can get even better results. So we just finished doing the 3 procedures. We did the Thermi-Tight to the face and neck, and then we did the ThermiRF. Then we did the platelet-rich plasma.
It really wasn't painful, especially the first process was very soothing and comfortable.
By tomorrow again, it'll look a lot better when this numbing and all the initial swelling goes away. And it'll look better and better over the next few weeks.